Hi, everyone. My name's Aaron Clark Ginsberg, and I'm a social scientist at the nonprofit, nonpartisan RAND Corporation. And it's my absolute pleasure to introduce all of you to the first of a three-part webinar series, From Crisis to Resilience. The purpose of this webinar series is to really explore some of the lessons learned and start to move towards good practice in disaster risk reduction in conflict and crisis-affected contexts. The series itself, it originated after a series of conversations that we've been having. So Goal, RAND, University College London, and Harvard Humanitarian Initiative on what works in conflict and disaster-affected contexts. We've been working on this issue for the past few years. We have some ideas, but we're also interested in hearing a little bit more broadly on what you think is working, good strategies, and how we can really move the needle and advance programming in conflict and crisis-affected contexts. So today's webinar, it's the kickoff webinar, and I'm delighted to introduce the moderator, Ambassador David Donahue, who will then be introducing the rest of the panelists and the speakers. Ambassador Donahue, he's currently at Overseas Development Institute. He's an lifelong Irish diplomat. He's served as Director General for what's known as today's Irish Aid from 2001 to 2004. He's also served as Political Director of the Department of Foreign Affairs from 2009 to 2013. He's had a long involvement in the Northern Ireland peace process and was a member of the Irish government negotiating team for the Good Friday Agreement. And as Ireland's permanent representative to the UN, Ambassador Donahue served as co-facilitator for 3 major negotiations related to sustainable development and co-facilitated the major negotiation of processes in 2014 and 2015, which led to the agreement on the Sustainable Development Goals and 2030 agenda. So he brings a wealth of experience, and we're really happy that he's going to be moderating this webinar. A little bit of housekeeping before I pass over the mic to Ambassador Donahue. I'd like to thank Irish Aid and the Party Initiative for Global Human Progress for their support for this webinar series. Thank you all for coming again. We will be hearing from speakers, and in addition, we're going to be having a question and answer session. So if you have any questions, please submit them in the question and answer session in the chat, and we'll pass them on to the speakers. And then if you're on Twitter and you want to join the Twitter conversation, you can follow the hashtag From Crisis to Resilience. So hashtag Crisis to Resilience on Twitter. Ambassador Donahue, over to you.
Aaron, thank you very, very much. Ladies and gentlemen, it's a great honor to have been asked to moderate this webinar. We have a great panel of experts who will speak about strategies to develop disaster resilience in different fragile and conflict-affected contexts around the world. They'll look at the various challenges and opportunities which arise, and they'll consider whether resilience should be seen as a remedy for fragility. Is that a useful analysis, or are there deeper structural considerations that we have to bear in mind? They'll also look at the value of systems approaches for enhancing resilience through disaster risk reduction programs in fragile and conflict-affected countries. My own background, as Aaron just indicated, is that I recently co-chaired the negotiations which produced the Sustainable Development Goals. I also co-chaired negotiations which led to the so-called New York Declaration on Refugees and Migrants. And again, that was an issue where conflict and displacement and conflict and disasters have really accounted for significant levels of migration and refugee movements around the world. I also am a former head of Irish Aid, as Aaron said. So across these various activities, there is a thread of building resilience, in particular responding to the needs of the poorest and the most vulnerable communities. In the 2030 agenda, we tried to sum up that moral objective in the phrase leaving no one behind. And we also added a sentence about reaching the furthest behind first. I think this concept underpins the Sendai framework for disaster risk reduction, which was negotiated, roughly speaking, in parallel with the SDGs. It was actually agreed a few months earlier, but it belongs to a set of agreements which were concluded in 2015 and which all have 2030 as their deadline. So I think of the Sendai framework as a parallel and very important exercise complementing the SDGs in many ways. So we want the concept of leaving no one behind to underpin all disaster risk reduction efforts. It's really the poorest and the most vulnerable communities who suffer the most, who suffer disproportionately from disasters, whether natural or man-made. The fragile and conflict-affected contexts in which they mainly live frequently lack the governance, the resources, the systems, the coordination of effort which are needed for resilience. Disasters often have the most devastating impacts in those countries and those areas. The effort to deal with a disaster in the short term is so overwhelming that very limited resources, whether human, financial, or organizational, are available to actually prepare and plan for the next disaster. People are knocked back by the short-term pressures which destroy their coping mechanisms, never very extensive anyway. So they have to deal with huge setbacks in terms of their future disaster readiness. We, of course, are witnessing at present a profound shock worldwide because of COVID-19. The world is still reeling from that shock, but it is the fragile and conflict-affected communities who will suffer the most. The humanitarian implications of the pandemic are enormous. I'm delighted that we have an opportunity with this webinar series to look in detail at how we can strengthen resilience, at the lessons that we can learn from many different contexts. Governments must, I think, go beyond mere management of disasters and must look at the underlying factors which exacerbate their impact, such as poverty, climate, poor urban planning, poor ecosystems, and so on. Disaster risk reduction must be integrated as part of national development plans. We need to invest in resilience at various stages to strengthen the capacity of people in the most fragile and vulnerable contexts to respond to shocks. All of these challenges, I think, have to be approached in an integrated way. When we are planning our responses to disasters and how to mitigate risk, we have to find ways of joining up and integrating more effectively humanitarian assistance with longer-term challenges of sustainable development. Both have to be seen as a continuum, I would suggest. Resilience requires both of these dimensions to be looked at together, and this is, of course, the logic of the triple nexus. All of these areas are mutually interdependent. As Antonio Guterres put it a few years ago, sustainable development builds resilience and sustains peace, and sustained peace enables sustainable development. Sometimes a disaster can itself become an opportunity to build cohesion and resilience. I remember Nepal, where there was an earthquake in April 2015. At the time, my colleague at the UN, the ambassador of Nepal, told me that the earthquake was itself helping to get the constitution, a new constitution in Nepal, passed, because it was unifying various political forces who had been at odds with each other up till then. But generally, it deepens underlying inequalities and imbalances in society. It leaves the most vulnerable communities even more vulnerable. I think of the impact, for example, of hurricanes and cyclones. There was one in southern Africa a couple of years ago, which devastated economies and societies. Or I think of El Nino. Disasters can threaten fundamentally the development gains which we're trying to make. We have to build defenses against them. National governments are often unable or indeed unwilling to provide essential services. So we need to mobilize international financial assistance through IFIs and the private sector. We need also to overcome distrust and to secure humanitarian access. We need to build or indeed to support existing local systems and local actors. We need to strengthen the contribution of community-based approaches, in particular involving women leaders at local level. We need to get a fundamental shift also in the mindset of donors, moving from the start choice, either humanitarian or development, to a combined approach involving multi-sectoral perspectives and multi-annual targets. We need finally to mobilize and support civil society as responders, as partners in building resilience. And we also need to ensure that there is a much greater availability of data and sharing of experiences, such as we're having through this webinar today. So with that, intended just as a few opening remarks, I have great pleasure in opening our panel discussion. We have four excellent panelists, and I begin by asking Nawal Arenas to take the floor. Nawal is the Deputy Chief of the Regional Office for the Americas and the Caribbean of UNDRR, in other words, the UN Office for Disaster Risk Reduction. He's had that role since 2017. He oversees the Making Cities Resilient 2030 initiative in the Americas. He was previously the Humanitarian Director for Oxfam in America, and he has led various humanitarian interventions, DDR programming and development cooperation over the past 20 years in Latin America and the Caribbean, and indeed in Africa and Asia Pacific. Now, well, over to you.
Thank you, Ambassador, for the introduction, and thanks to all the organizers for inviting me to participate in this very important discussion. More research and learning is actually needed with regards to implementing DRR in fragile and conflict-affected countries. And this has been indeed a challenging area of work for the DRR community, because fragility and conflict act as barriers to disaster governance. And my main message in this presentation is going to be that in our global context of complex interconnectedness and systemic risks, a systems approach is a way not only to improving the understanding of risks and its cascading effects, but it's also an approach to strengthening disaster governance and, as you well said, Ambassador, making the link with risk-informed development pathways. So I will share with you some of the conceptual approaches that we are advancing from UNDRR to boost the implementation of the SNI framework in this global context, and share with you some examples from the region of the Americas and the Caribbean. So first, let me frame the discussion by underlining that violence, conflict, and fragility are part of the disaster risk equation. They make people vulnerable, and they can directly affect how, when, and where a disaster may happen. Violence, conflict, and fragility, as I said earlier, disrupt disaster risk governance, reducing people's capacity to cope with, to prevent, and reduce the impact of hazards. And the relationship is both ways. Conflict and fragility can make people more vulnerable to disasters, and disasters can also contribute to violence, fragility, and conflict. And for this reason, I think DRR is actually very important in this context as well. The Sendai framework is not very explicit about these links, but the Global Assessment Report 2019 in Chapter 15 actually covers these linkages quite well and presents studies from Sudan, South Sudan, Central African Republic, Somalia, Cox's Bazar, and so on. So, in short, all this needs to be factored into DRR strategies. And these links are present in many DRR strategies and plans in this region of the Americas and the Caribbean. You take, for instance, the case of Colombia. The national plan defines disaster risk management as a development policy, contributing to offering protection to people, to improving security, collective rights, and wider sustainable development. And in the case of Haiti, they actually include armed conflict as anthropic hazards, and they underscore the contribution of DRR to human security and conflict prevention. But the reality is that we need to go beyond just acknowledging those linkages. In our world of increasing complexity and interaction of the human, economic, and political systems with the natural systems, risk becomes increasingly systemic. And this has been made very evident with the pandemic, but also think of climate change due to global warming that is now contributing to environmental degradation, loss of biodiversity, with impacts on food production, impacts on international trade, impacts on the volatility of markets, on political instability, and in some cases, bringing violence and forced displacement. So the increasing connectivity in the world means growing complexity. This interconnectedness has turned into a complex interdependence, and this complexity is leading to increasing systemic risk. So we therefore need to take a broader and more nuanced approach to understanding how threats, hazards, and shocks interact. And this requires moving towards utilizing systems thinking, grappling with complex risk, and engaging with uncertainty. Because uncertainty is the new normal. We see new risks and correlations emerging in a way that we have not anticipated. We see change happening more quickly and across multiple dimensions and scales that we ever thought possible. So we must anticipate. We must allow room to deal with surprise, to deal with non-linear change with flexibility in our strategies and plans. And this means adaptive, anticipatory planning frameworks that can identify the risk drivers across the different systems to prevent and to mitigate a risk, but that can also allow implementers to react quickly, to react through quick learning, feedback, and learning loops, and ideally with funding decisions that are made as close to the ground as possible. So addressing complexity and addressing systemic risk is not something that we can achieve quickly. It's perhaps a process, something that perhaps we can prevent, but we need to manage. And it requires long-term engagement across sectors and multiple levels. So we need to seek to align in line with what you were mentioning, Ambassador, seek to align DRR efforts with international and local humanitarian and development partners, with national and local governments, with local communities, with the private sector. The private sector accounts for 75 to 85% of investments in any given country. So we can only boost risk-informed development and investments that contribute to resilience through engaging with the private sector. And in general, strengthen governance structures to enhance coordination across sectors and at multiple levels. So this means that we stop departmentalizing risks, that stop understanding risk in compartments. Systemic problems require systemic approaches. And this is particularly critical at national and government level. So it can be practical to categorize risk so that we can delegate responsibility to different institutions, organizations, to different individuals. but we need to do more to incentivize a transdisciplinary, integrated, multi-sectorial risk assessment and decision-making to allow for connected and collective action. And to promote this on the ground, UNDRR is piloting an approach that we call the Global Risk Assessment Framework that is being now piloted in the Americas region in Costa Rica, but also in places like Somalia, Sudan, Bangladesh. And this is a long-term initiative that aims at strengthening the capacity of countries to develop and use a risk analysis that comprehends this interconnectivity across different systems and the cascading and compound nature of risk. So the graph is not so much a method, it's rather an approach that seeks to break the silos, creating linkages across existing data sets. For instance, linking climate change projections to hazards, socioeconomic vulnerabilities, and exposure data. So it's not so much about creating new data sets, but about combining currently siloed data sets and encouraging data standardization and increased interoperability. And the idea is to pursue a sustained multi-year collaboration so that state institutions have the tools that they need to better recognize this systemic risk and apply sustainable risk management strategies at all scales. So finally, to end my presentation, I want to underscore that it all comes down to acknowledging or rather remembering that systemic risk and risk in general is socially constructed. And that systemic risk refers not only to the cascading and non-linear impacts across social, natural, economic systems, but also to the way that risk is accumulated in those systems. And in fragile context, there is a special accumulation of risk. So that is why when we think of DRR, we should not only think in prevention and preparedness, but above all, in strategies that help us to understand and address the underlying risk drivers such as poverty, inequality, badly planned and managed urban and infrastructure development, environmental degradation, climate change, and also conflict and displacement. Disasters are actually the first cause of displacement globally. So all these aspects configure hazard, vulnerability, and exposure. And this is why the only way, in line with your introduction, Ambassador, the only way to advance sustainable development is through putting risk and vulnerability at the center of our collective efforts, seeking to leave no one behind. Thank you.
Thank you very much, Noel. Extremely interesting remarks. So now we turn to Dr. Ronak Patel. Ronak is Director of the Urbanization and Resilience Program at the Harvard Humanitarian Initiative. He focuses primarily in his work on the challenges and opportunities presented by rapid urbanization for the health and well-being of vulnerable populations and for the handling of humanitarian crises. In his work, he tries to identify and to disaggregate cumulative risks to health and development and to develop tools and interventions which can mitigate these. He's done projects on resilience to urban violence, on social cohesion and DRR, on gender-based insecurity and mobility in urban slums, and on a framework for measuring urban fragility and resilience. Ronak, over to you.
All right. Well, thank you, Ambassador, and thank you, Nahuel, for getting us that fantastic start. I want to just take a moment to thank everybody for participating once again and welcome everybody to the webinar as well. You're part of making this a big success, and I can see we have over 200 attendees so far just on this. I'm hoping we'll have a very good and lively discussion. This is really meant to be interactive, and we'll get to that after we're finished with some of these presentations. So Nahuel did a fantastic job of presenting what the problem is from the policy perspective and how it's adapting to these complex situations, because as he mentioned, they're very much a part of what DRR needs to be focusing on. So what I'm going to do is take this a step further and talk about a small research project that we did as collaborators to try to explore this topic as well and come out with certain lessons that we might identify as strategies in these environments. Now, this was done as a combination of the collaborators you already saw and mentioned that Aaron discussed: GOAL, the Harvard Humanitarian Initiative, RAND Corporation, and the University College London. And it started as this co-creative process. We had already been working on some research together, had some papers and thinking about future projects. And it looked at some of this existing research and secondary data. And then through discussions, we tried to tease out what we thought were the initial lessons from this case study, specifically focusing on Northwest Syria. It led to the publication you see cited at the bottom here. So please feel free to look that up. I believe it's open access and you could go through that as a corollary to this presentation. But let me just briefly present to you how we got started on this and what we found. And so the reason we started to look at this was exactly what the ambassador mentioned. So if you're looking at fragile and conflict affected contexts, and I want to just briefly identify that so we are all on the same page. You know, it's obvious to understand armed conflict, and active conflict setting is one of those. But we also mean the immediate post-conflict setting, because we think it has very strong similarities in which governments or authorities may not have the ability or willingness to act on DRR or the capacity to do so. And then the fragile context that Nahuel so well defined also means that those institutions may be weak or unable to actually perform the DRR work that's necessary for these populations. But really getting back to what the ambassador said, if you really want to focus on these most vulnerable populations, then you have to look at the fragile and conflict affected context. And Sendai, when you start with that as the starting point, often frames the central government as that authority, and that may be, again, weak, unable, unwilling to be able to do some of this work. And then the most vulnerable that the ambassador identified are also bearing the brunt of this lack of approach or lack of focus on DRR when everything else is taking precedence in a conflict or post-conflict setting. So inclusive DRR for us as the research group meant that, you know, no one is left behind, but it means really focusing on these fragile and conflict-affected contexts for DRR's work. So going back to Sendai, when we looked at some of those priorities and actions, it seemed to present a lot of challenges for these contexts. Now, I don't want to beat this with a dead horse, but I just want to point out those parts that are challenging as part of Sendai. So just priority number one, right? Understanding disaster risk. And in these contexts, we often have a lack of quality and timely disaster risk data. So even if you had the intention to work on this, those contexts present a challenge in being able to have the data to work on, because so much of that time and effort on data collection or programming is focused on the actual armed conflict or conflict setting. Strengthening disaster risk governance, again, like we said, when we focus on the central governance as the linchpin for action, that often is unable or unwilling to implement DRR. Investing in disaster risk reduction, the building back better, often that's limited or absent, again, because so many other things take priority or precedence in these, sometimes appropriately so. But as we all know, there's a lot of work and effort that we need to make on ensuring that all hazards are protected against, not just the conflict. And that goes to this priority number 4, where it talks about enhancing disaster preparedness, the recovery and rehabilitation. But as we all know, given these contexts, how protracted they are, how often they seem like consecutive crises layered on top of each other, or cascading crises, it's almost hard to take that step back or that larger picture, that systems approach, to say, where are all the other hazards? And as many of you know, this case study from Northwest Syria, it wasn't just the conflict. There was droughts, there was harsh winters, so other types of hazards that had to be dealt with, but sometimes didn't get the attention necessary to protect these most vulnerable populations. So Nahuel mentioned that global assessment report, and it very rightly goes beyond Sendai and mentions these contexts in chapter 15 specifically, with case studies and some policy prescriptions. What we did was take somewhat opposite approach by looking at the case study and trying to tease out some of those lessons, but I'll show you later in this presentation where there is some striking similarity between those policy prescriptions and what we found in the research. And so this comes from GOAL's disaster-informed humanitarian response in Northwest Syria. So its programming focus it should be in the beginning, has been on providing that immediate relief and basic humanitarian support. Very importantly, it's been on doing that by stabilizing and strengthening local systems to build that resilience when possible, or quickly transitioning to that type of focus as opposed to just providing aid in kind. And so what we looked at in these cases were the bread market system and the water supply system. And it's very important that we call them systems, because that's one of the strategies we found out. And as Nahuel mentioned, one of the key themes and priorities for approaching these types of complex problems. So some of the specific lessons that came out of these two systems, we try to group those into various strategies. And that systems approach, again, is very important. So if you looked at the water supply system, Goal looked at it from beginning to end and thinking about how can it be supported, where are fragile in them that need to be supported to make sure that local supply system goes from where it is into the hand of the consumer. And that meant things like looking at just water unit staff and supporting their salaries, or technical capacity and building that capacity locally, or leveraging it from outside temporarily when necessary to make sure that water systems still work, because sometimes that technical capacity or skill set isn't there. Even to the point of providing fuel for transportation, noticing that that was a critical element of making sure that people got their water, right? So again, looking at that entire system, the interdependencies that Nahuel mentioned, and figuring out where those cause and effect relationships are to make sure that system worked as a whole. The other part of this was being very flexible, and this came under this category of adaptive management. Now, that's a bit of jargon. It comes from the world of ecology, much like resilience, but it's often used very loosely. And so sometimes people will say, well, we do adaptive management because we did a survey and got some feedback and changed a decision. But what we found through Goal's work is that it actually, in these contexts, needs to be a lot more rigorous and a lot more intense. So, for example, in the bread market system, there was almost continuous risk analysis, contingency plans layered into this, and then very specifically using a lot of technology and data collection to get mobile data, continuous data on the bread market system and how it was working to make sure that it was meeting people's needs. And that allowed them to change decisions. Again, that comes with an entire infrastructure and architecture of how you do this, in addition to long-term funding that's multi-annual and flexibility in how you approach. But the important part was it wasn't 6 months of a bread market system that was static as a program. That program changed in style and manner as they got feedback and learned how it was failing or not to meet needs. Another area of this was, again, local systems. And that is something that you've heard in humanitarian discourse for a while, the localization agenda. But again, very important to figure out how you can build that resilience, because instead of creating those parallel structures, looking at what's endogenous there and then supporting those local actors. Now, that can be doubly complex in these fragile and conflict-affected states, as we know, because it can compromise your principles or challenge them, because some of those actors present may not be the ones that allow you to maintain impartiality or neutrality. But figuring out who those permanent actors are that you are allowed to engage with and supporting those systems is very critical. That's the way you can build these local systems that can be more sustainable. Then you can think about making more disaster resilient as time goes on. And then finally, a part that we think came out and we didn't see in much in a lot of these policy prescriptions or other discourse is the issue of trust. You know, that breaks down a lot in these contexts, and people are looking for that. When you're lacking just basic human security, having faith in a system that is delivering your needs or having them met means building trust in that system. So what Goal had built was these types of assurance framework where they would get feedback from the community, specifically in the types of water system, and then do communication or change their approach so that it met those needs. That thereby people saw something that they could, legitimize by having trust in it. And that way, once you see that and you have some long-term ownership or stake in this, then you can think about supporting that system and building it stronger and building resilience to it, because then you can feel like, yeah, I have some ownership of this. I have some trust in this. Otherwise, it's hard to even get past that point where we talked about thinking about the continuous crisis and just getting those immediate needs met and getting to that disaster resilience or risk reduction part of it. So these are the 4 strategies we bring out in the paper. Again, the systems thinking, the adaptive management, localization, and building trust. You can see how we categorize them. Again, we want to be clear that we present these very humbly. They're exploratory research from a simple case study in Northwest Syria from these programming. And obviously, we want to build on these and refine them. But just going back to that global assessments report, you can see some similarities. So if you look at that chapter 15, it talks about addressing a wide range of vulnerabilities where these risks combine. And that allows tells you to take that systems approach, because you want to look at where that system might break down, as Gold did in the water, to see what needs to be supported and what might be facing future risks from other hazards. Then the adaptive management, clearly the strategy in the global assessment report that talks about the dynamic nature of these situations and being flexible with that management, critical, brought that out as well. And then the other one was this engaging long-term actors and sectors across multiple scales. Now, that's not so much exactly that localization agenda, but it's part of it. And it's part of what the ambassador talked about, that triple nexus, and looking at these other approaches, the shelter and settlements approach or area-based approaches. You've heard of these under different names before, but it means, that multi-sectoral localized approach that can be supported. And as, Nahuel and the ambassador mentioned, it sometimes doesn't have to be just that local system. You have to look at those interdependencies outside of there and then leverage external resources, as Gold did, with technical expertise when necessary, if it's not there, but with the aim of focusing on building that local system in the future. And again, finally, that building trust. Like I said, we haven't seen that so much in the discourse, so we want to keep exploring that because we saw that come out through this case study as a very important part of it. So the next steps, like we said, this suffers from the limitations of being a case study approach with one example, 2 examples from one location. We want to now do some more, build that out, see what needs to be refined with these strategies, what should be added or subtracted. And then, anytime you try to take this systems approach, it's hard to understand all of these complexities in their entirety. So we may have clearly missed some things or misrepresented some things. More work on this will help us do better. And we want to do that and look at these approaches and see how it matches. And then finally, I want to end with this graphic, which I like very much and actually goes very well with what the ambassador talked about in the global frameworks and how they're building and supporting, looking at the SDGs and how development gains can be protected, and how Nahuel mentioned about those complex interconnectedness outside of these fragile contexts, regionally and internationally. And what you find, and what Gold has been doing in their work, is noticing that when they try to adapt to these vulnerable populations, they're noticing that those same vulnerable populations that cross a border and become refugees in neighboring states, there's similar complexities to supporting them and building their resilience. And so we think there's some nascent area of research for us to focus on this diagram, as you see here, that we'll try to build upon as part of this research collaboration. All in there, and I know that we'll have time for questions later, and then I think we'll have a very, very nice follow-up with Georgina. Back to you, Ambassador.
Thank you very much, Ronak. Thanks a lot for that. Yes, we'll move on now to Dr. Georgina Jordan, who is Head of Emergency Response at GOAL, a leading Irish NGO. That means Georgina is in charge of GOAL's emergency preparedness and response function. She was previously with the multi-agency program Facilitating Assistance to Syria Together, known under the acronym FAST, which USAID has funded. She has also been a co-director of the Resilience Measurement, Evaluation and Learning Community of Practice, which the Rockefeller Foundation has funded. She was also the Program Quality Director with World Vision's International Global Livelihoods Program. She holds a PhD from Durham University in the UK, where she focused on resilient livelihoods in fragile contexts. And she's also done a master's in international agricultural economics. Georgina, over to you.
Thank you, David, for the lovely introduction, and thank you to the 2 speakers beforehand. You're very well informed, David. And anyhow, so I've been asked today really to focus on the practical aspects of this. Often, when we have these type of webinars, we hear the theory and the research, and the practitioners in us want to know, why did we do it and how did we do it? So that's really what I will try and focus on today. So again, I'm going to expand on the 2 presentations we've just heard, and I will again look at goals programming focus, which was to provide immediate relief and basic humanitarian support and stabilizing and strengthening local systems to build longer term resilience. This type of approach very much fits in with Goal's own organizational values of courage, humanitarianism, partnership, respect, and integrity. And so I really would like to focus on this from the practical aspect. So building on the previous presentation, what we did find was the importance of that systems approach, building trust, localization, and adaptive management. And I think the one as a practitioner that I would highlight as important is that whole adaptive management. It's incredibly important before you look at systems approach, building trust or localization. Adaptive management means flexible multi-year funding to partners. It means continuous risk assessment planning, continuous contingency planning, and continuous data and technology to inform risk, learn, and change your programs as we go along. So it's very, very important that we have these systems in place prior to trying to attempt to build systematic approaches, localization, and building trust. I would like to look at two case studies that we've already mentioned from Northwest Syria. And these case studies are important because they highlight, I guess, the conflicting priorities sometimes of meeting immediate humanitarian needs versus building longer term resilience of systems and structures. When we talk about DRR in fragile and conflict affected context, the ability of the system to meet humanitarian needs is important, but the ability of this system to adapt and meet future needs, future shocks, future stresses. And as we saw in the last 2 years, some of these are unknown. So it is the resilience of that system for the future that's important. So in the context of Northwest Syria, there's about between 4 and 4.5 million people in that little pocket of Northwest Syria. The figures are not exact. Many of them have experienced multiple displacements. To be displaced 9 times is not unheard of, and even there's reports of families being displaced 11 times. So Goal does have to provide humanitarian support in these communities to both IDP communities and communities who are already there. But at the same time, it's important that we do also focus on stabilizing strategies and local systems. This longer term resilience is incredibly important for the future. Even in these fragile humanitarian contexts, we do need to ensure that things for the future are maintained and moving forward. In Northwest Syria, agencies have struggled to meet basic needs, shelter, water, food. A humanitarian access team report in 2021 highlighted that the average unskilled worker now had to work 69 to 141 more hours a month to purchase the same basket of essential items depending on location. This, of course, led to a huge increase in negative coping strategies, including the use of credit, lack of food consumption, and selling of assets. So again, these are immediate needs that need to be supported. At the same time, with a DRR focus to reduce future shocks. Let's start with the water systems approach. Prior to the conflict, the water infrastructure in Northwest Syria was already experienced pressure because of population growth and urbanization. Post-conflict, quite a lot of water stations were damaged, mostly due to airstrikes, barrel bombs, and in many places there was no electricity. Those people who were lucky enough to have piped water often didn't receive a lot of what they should have got because of leakages and unfunctioning systems and delays in water delivery, again, largely due to no electricity. On top of this, prior to the conflict, the government of Syria had subsidized the water supply system. So the price of water became incredibly expensive in the context of already a population with a lot of economic pressures. So UNOCHA in 2019 estimated that 40% of household income was already going on water supply. In Idlib, where this project focuses, 45% of the population the only water they had access to was through water trucking, which is costly, expensive, often untreated, and the source of water is often not known. So Goal recognized in this context, we need to meet these immediate needs. And I have a quote here that I particularly like when I was reading this case study from Rima, not the lady's correct name, but I just wanted to highlight the need we're talking about. We used to stand in queues to get drinking water and did not care if it was clean, healthy or not. What mattered to us was to quench our children's thirst. So again, that is a real humanitarian need that must be addressed. Through this project, Goal was able to deliver piped drinking water to 1 million a day. However, that is just addressing immediate needs. This system had no state institutions to support it. And so Goal supported 4 of the largest municipal water institutions and 66 water pumping stations. We supported the critical infrastructure. We provided fuel to these pumping stations, build capacity of the water units and the staff, and we've provided the salaries to support the 300 staff. The aim of this project was to protect and stabilize local systems rather than to replace them, either through unsustainable practices such as water trucking. And hopefully by doing this, we could mitigate the impact of crisis now and in the future and accelerate the transition of these systems back to local actors when the conditions allowed us to do it. Now, again, what's important is the ability of these strong, resilient systems to adapt. And of course, COVID testing in Northwest Syria is challenging, but in August, there was a 372% increase in COVID-19 cases. A REACH report from this September highlighted a lack of PPE on local markets, and in particular highlighted the lack of masks and gloves. So imagine the importance of water in that context where you have a rise in COVID, but you have no PPE. So of course you have no gloves, so you need to be able to wash your hands at the most basic level. So that's one system that we've supported, and it was able to adapt to a future shock, which of course is incredibly important from a disaster risk reduction perspective. The other one I wanted to look at was the bread system. So bread has always been a staple in Syria, and particularly in Northwest Syria. Prior to the conflict, Syria produced enough wheat to meet its own domestic consumption needs for bread. And I believe at some stage they were actually exporting a bit as well. However, due to multiple factors, and some of it is physical destruction of bakeries and fuel crisis and lack of subsidized flour and currency depreciation and a number of other factors, it led to a country-wide bread crisis. 46% of the population, because of this, cut their daily food rations, and in 2020, 1.3 million of the population of Northwest Syria was considered food insecure. So again, this is the why, this is the immediate needs. So what did we do? Goal provide critical flour and yeast inputs to 52 bakeries. We supplied bread at agreed and subsidized rates and conditions to a network of over 400 plus vendors. And this resulted in bread being able to be purchased at 38% less than the market price. So again, addressing the immediate humanitarian need. However, the focus on localization, building local structures, offering capacity building and subsidized inputs allowed us to focus on the system. And again, this project was originally designed to give access to bread to 300,000 people. However, due to the huge increase in the IDP population, the project was able to expand the system because of the resilience and the investment from 300,000 to 560,000 individuals. And again, we were able to use technology to monitor market prices and continuous assessments through monitoring tools such as ComCare. So I wanted to use those two examples to say that we recognize humanitarian needs do need to be met, but at the same time, moving forward, we do need to make that critical investment in DRR infrastructure, in particular in areas which was highlighted from some of my fellow colleagues, where you may not have a functioning administration, let me say. And the last point I wanted to say was, beyond this, we have started to look at this now for other contexts. And one example was the health system in South Sudan. So GOAL is now focusing on building the capacity of the Ministry of Health at the national and the county level to improve the leadership, governance, and coordinated service delivery. GOAL focuses on strengthening the Ministry of Health and not taking its role. And again, an important point, GOAL itself is not paying incentives to staff, but to the Ministry of Health, so they can pay the staff and incentives. And in particular, this is important in remote parts of South Sudan, where perhaps health workers weren't always attractive to work. So as part of this and the localization aspects of this, we're also looking at increased community engagement and looking at how jointly we can improve the health infrastructure. We're also focusing on improving resilience to prevailing shocks and stresses, in particular conflict, flood, and drought. So there's those two examples from Northwest Syria and one from South Sudan to say that, yes, we do need to meet humanitarian needs that are immediate, but at the same time, we need to have our eye on the bigger and the future picture by strengthening these systems to strengthen disaster risk reduction in these contexts. Thank you very much.
Thanks a lot, Georgina. That was great. And now I turn to Patrick McManus, our last speaker, who is the Deputy Director of the Policy Unit in Irish Aid, which is part of the Irish Department of Foreign Affairs. Patrick joined Irish Aid in 2008. He was the Head of Development at the Irish Embassy in Lusaka, 2012-16, and in a similar role at the Embassy in Addis Ababa, 2016-21. He has also worked as an evaluation manager in the Evaluation Audit Unit at the Department of Foreign Affairs. Earlier in his career, he spent 10 years with Concern Worldwide in various roles, both in Dublin and in the field. He's from Northern Ireland, and he has also worked with civil society organisations supporting the Northern Ireland peace process. Patrick, over to you. I think you're on mute, Patrick.
Can you hear me now, yes?
Patrick, there you are now. Now I can hear you.
Okay,
yeah.
Thank you. Thanks, David, for the introduction, and thanks to our GOAL colleagues for the invitation to participate in the webinar tonight. So as the only donor, I suppose, on the group tonight, I hope to present some of the policy frameworks and contexts and policy positions of Ireland in this very important area. And maybe the next slide, please, Samuel. So a question you might ask yourself, so why is disaster risk reduction and management important for donors? The OECD, in fact, currently classifies somewhere around 60 countries as fragile and estimates that perhaps without further action, more than 80% of the world's poorest people could in fact live in fragile contexts by 2030. The World Bank has calculated that disasters cost the global economy some 520 billion per year and push some 26 million people into poverty each year. It also estimates that at the same time that for every dollar invested in prevention ends up saving between $2 and $7. So disaster risk reduction, as well as preventing millions of people of falling into poverty and saving lives, it also saves money. So for donors in a very stretched budget environment, this is important over the longer term. And in fact, also helps us in terms of our accountability to the taxpayer. Next slide, please. One of the questions we were asked to maybe look at was this question of, is resilience a remedy for fragility? It's a really great question, actually, a great framing question. But of course, shocks can never be avoided entirely. But development actors should and can help governments and communities to build resilience and reduce disaster risk through new ways of working that help anticipate and deal with major complex risks and address the root causes of fragility insofar as possible. And some of the colleagues have already pointed out key challenges in fragile contexts is this issue of complexity, that difficulty of separating one issue from the other. Those multi-intersecting vulnerabilities, poverty, exclusion, protracted crises, climate change, all of which are really interlinked. This makes the targeting of aid often very difficult and often results in the siloed approach to our programming. In conflict-affected contexts in particular, this is also often exacerbated by access challenges, as is the case at the moment in Tigray region of northern Ethiopia, where it's hard to get access, be you local government, be you UN agency, or indeed local or international NGOs. So what can donors do to help in this context? Next slide, please. This slide tries to present in a sort of schematic way Ireland's current international development policy, which we call A Better World, which was issued nearly 2 years ago now. You can see at the top of it, actually, that Ireland prioritizes the furthest behind first, and I think David alluded to that in his introductory remarks. Those people and communities who are the poorest, those who are most vulnerable, those who are most excluded. And that means in practice, poor women and girls, the elderly, and people with disabilities, we are always disproportionately exposed to shocks and stresses, on top of the deeper structural inequalities. You can see in the slide that for Ireland, we've set out 4 policy priority areas: gender equality, reducing humanitarian need, climate action, strengthening governance, and through those to what we call our intervention areas of food, people, and protection. So for us, if you like, this is our internal system, our overarching theory of change, through which we believe that we can make the biggest impact on those who are furthest behind. Next slide, please, Samuel. If I was to flip just for a moment disaster risk reduction onto our policy priority area of reducing humanitarian need, for us, Ireland, we would see 4 tracks for delivery. We want to really build on our reputation as a principled and effective donor. We want to deliver on our grand bargain commitments. We want to continue to focus on where the needs are greatest and deliver in a way that builds the groundwork for development. This also means a continued strong focus on gender and gender-based violence, and of course, increasingly on climate change as a driver of vulnerability. At the same time, we believe that our impact goes beyond our financial support. We seek to build stronger systems and structures, which in the long run mean more effective responses. This is about how we work and influence at global, national, and subnational levels. It's about our networks and partnerships, about the leadership roles that we may take up. And particularly important is how we engage with the EU system as an EU member state and also the UN system. Working effectively in fragile states means we must have a stronger focus on prevention, earlier and sustained development programming, anticipatory action and coherence across humanitarian development and peace programming. For us, we need to ensure that our funding supports all of these areas. We will want to build our strong history and reputation on conflict prevention and peace building. This includes our support for the UN Peacebuilding Fund, the Women, Peace and Security Agenda, and indeed the civil-military coordination. Next slide, please, Samuel. So therefore, this means that our priority is really to reduce humanitarian need, but by working effectively across the humanitarian peace and development nexus, the so-called triple nexus that David remarked in his opening remarks as well. Just to say that I know a lot of the focus in the presentations and the webinar has been on the Sendai framework, and Ireland for its part fully supports the Sendai framework, but we'd have to say that more recently, the humanitarian peace and development nexus has had more currency with us both in our global work and also in our mission work. And it's not to say that these are different frames, but it's just perhaps a different lens, a different emphasis that more recently we find more interesting for us. We've signed up to the OECD DAC recommendations on the triple nexus. And therein, we have committed to 11 principles across the 3 areas of better coordination, better programming, and better financing. While we would accept that the imperative to respond to acute humanitarian need will almost likely be with us for a long time, but at the same time, we take the approach of prevention always, development when possible, and humanitarian action when necessary. For the next slide, please, Samuel. You might have to push that on just a second. Yeah, thanks. I just wanted just to touch on one of Ireland's biggest areas of investment over many years now in Ethiopia, and that is the Ethiopia Productive Safety Net Program, which I think maybe is known to quite a lot of people. Ireland has been involved in the PSNP program for really since its inception. And it is indeed, and quite rightly, highly lauded for its impact on those who are most vulnerable. Those who are most vulnerable to shocks, be it induced by conflict, climate, or indeed other hazards. And the PSNP program, in terms of its original origins, in fact, goes back to the 1980s, after the terrible famine of that time. And this is, in fact, a response by the Ethiopian government to try to address the repeat cycles of humanitarian need. It now has a caseload of 8 million really every year. And it's become over the years a very refined and efficient, if not always perfect, system. But it does work very well in pulling together several of the ministries in the Ethiopian government, particularly the ministries of finance, ministries of agriculture, and the ministries of affairs. In terms of the governance system, it's led by the Ethiopian government and works very well. And the job of the donors, and Ireland being one of them, is really to roll in behind that and support that program. And it's centered around cash and food transfers, and always has been. But at the same time, it's not just a cash and food transfer program. We consider it, in fact, as a resilience building program at a household, community, and government levels. It builds household and community assets, productive and climate adaptive infrastructure, reduces hunger gaps, and helps households graduate to sustainable livelihoods, and has opportunities through to health and education services. So it's quite a complex system, but over the years developed into a very effective system. The little frame which on that slide really is an attempt to show how the program works across those absorptive, adaptive, and transformative dimensions of building resilient capacity across the household level, community level, and indeed government institutional level. So it does map across very well, right across that space, if you like. And for the Embassy and Alice, we found it a very useful tool to help us interrogate how well the PSNP program has been actually addressing building resilience at all levels. And also, it helps us to interrogate even pathways through that framework. Samuel, if you push on the next slide, you'll see a little how you might interrogate a program, how individual households can move from absorptive level of capacity to perhaps more adaptive or later more transformative positions. So it's a very useful framework we've used, if you like, as trying to take a system approach to a very large national program. At the moment, the PSNP program is in its 5th iteration, and is trying to even take it further and move to what the discourse of government and the donor group is to take it to become a shock responsive, scalable social protection system. So that 8 million core caseload can scale up and scale down if needed in any one year if the needs increase due to new shocks. At the same time, in terms of the government system, we're trying to encourage the PSNP program, which is really run by the Ministry of Finance and Ministry of Agriculture, to talk to the humanitarian response system, which is a little bit parallel and is actually run by the National Disaster Risk Management Commission. So there's a lot of work to do in that area yet, but we think it's moving in the right direction overall, as an overall government system. And just to move on to the last slide, and just to conclude, I think I'll just leave this slide up. It's just to touch on Ireland's work at a global level, and perhaps most of the listeners know that Ireland is currently on the UN Security Council. And in September, in fact, we had the presidency of the council, and we were very active at our Prime Minister level, our Taoiseach level, and our Minister of State level, and indeed our President, in hosting different interventions at the Security Council and also our meetings, particularly around the area of peacekeeping transitions, and also highlighting the links between climate and insecurity, and also climate adaptation and risk reduction. Our president made a very important speech at the start of the UN Food Systems Summit. And that area of food systems, and particularly the nexus between food systems and climate, is something that Ireland in its policy priorities and programming over the next period will actually receive particular attention. So I think I'll pause there, just highlighting some of our policy priorities and positions, and happy to take questions as they arise. Thank you very much.
Thanks very much, Patrick, for that. That's very, very helpful. So we will now have just some questions to the panelists, but I won't take too very long at that, because I would like it to open it up to the attendees in about 10 minutes time. So in fact, at the latest. So let me just put a couple of questions to the panelists, and thanking indeed all four of them for excellent presentations. Now, well, if I could just begin with you, I mean, there were many interesting things you said that would bear elaboration, but one was the question of the global risk assessment framework, which UNDRR is piloting at the moment in various parts of the world. I think our audience would probably find it interesting if you could just develop that a little bit further, just to explain how it works, what the approach would be. And just my second small question is in relation to the Sendai framework. Now, do you think that we suffer from the fact that there's really no explicit reference to conflict in that framework? I mean, in practice, we're getting on with it without that, but it is odd, really, that neither fragility nor conflict are specified in the Sendai framework. But look, do the best you can with those two questions to begin with.
Thank you, Ambassador, and thanks to all participants for your interest in this discussion and for the questions. I've been attempting to respond to some of them in the Q&A chat box. With regards to the graph, yes, in addition to what I explained, I think it has different pillars, this project. One has to do with increased access to information and to data. Priority one of the Sendai framework, the first step is to understand risk. So increased access to hazard, vulnerability, and exposure, and climate data for decision makers. The second aspect, perhaps I did not touch upon so much, and it's a good opportunity to do so, is that what's accompanying the project is a network of experts, both regional and global. So we are working with, from experts from NASA, from NOAA, from global institutions that are there to support these pilots and to support countries with access to more information and more data. So we are engaged in a global network of experts to support the process. The third pillar has to do with building capacity. And sometimes, I mean, one of the gaps that we find is DRR capacity across different sectors, because we usually tend to engage with the usual suspects, but we need to start engaging with varied and different stakeholders. So we are trying to, for instance, we've been working together with the government of Singapore in an initiative to build DRR, disaster risk reduction, and DRR financing capacity within civil servants of the Ministries of Planning and Finance in the Caribbean. So this is just an example. So building capacity across the different sectors it's another pillar. And then trying to influence decision makers, trying to influence agenda setters, and trying to influence the financing systems so that the process is also accounts with the resources to make decisions on the basis of available budgets. So that's on the graph. On the 7 framework, yes, I acknowledge it could have been more explicit, and this you are a better place than anyone to know how these negotiations go about, and sometimes there's issues around the wording. But the bottom line is that this has not prevented us from working in any context. And I think that there was one question about opportunities to work in conflict and fragile settings. We actually work in conflict and fragile settings, and things are getting done. I think that we delivering DRR, it's possible in any context. It is a scope of what is viable. It is a scope of what is appropriate that will change depending on the context. And I think that what the research that was presented shows us is that we need to acknowledge that states have different capacities, different capabilities, and instead of prescribing the conditions needed to pursue the more traditional or more conventional DRR approaches, we need to acknowledge the limitations that may exist and find ways to work around them. So through innovative approaches, through involving different stakeholders, and so on and so forth. So, and this is why the graph is actually, connecting with the first question. It is being piloted in Somalia, in Sudan, because the approach needs to be flexible. That's the whole point of the approach. I stop there.
Thank you, Noel. Thank you very much for that. A question now for Sunny Patel, and by the way, Sunny is just stepping in for Ronak, who had to leave a moment ago, and Sunny is with the University of Sydney in Australia, but he's also, let me just quickly give your bio, Sunny. He's also at Harvard Humanitarian Initiative and a visiting scientist at Harvard's Chan School of Public Health. Sunny, could I just ask you about the prospects for increasing finance to mitigate disaster risk? Do you think what scope do you see for increasing the readiness of, let's say, the IFIs, the international financial institutions, to mobilize finance specifically for mitigating disaster risk?
Thanks, Ambassador, and thanks everyone, and thanks for the great question. Please bring in more and more questions. The participants here, please add it to the Q&A. It's quite a lot. I think Patrick was mentioning a little bit of this, and I'll defer a little bit to Patrick because he was mentioning a little bit the finance with this. But from what we found from looking at the cross section from our case study in Syria and to others, finance is very important. And I think one of the questions from the Q&A, the participant brought up a great point about how it's important that it's not just a health, it's not just the initial disaster impact or the conflict impact that intersects of it that creates this fragility. It's an existing fragility that created before the impact even occurred, from poverty, from other actors that are not be able to cooperate with others. And so when it comes to finance, it becomes even more complicated, as you know, Ambassador, negotiating all this from the political scenes and from even the rhetoric that, as Naul mentioned, the rhetoric that comes in, when you're in a conflict, and not showing any sides to one area if they need to be neutrality. But Patrick, I wonder if I could bring you in here to talk about a little bit about the finance, because I think that you mentioned that, and you could elaborate on that.
Patrick, please.
Yes, of course, there's a huge challenge across the international development community, particularly, I think, as we come out of COVID and we find that we're all increasingly indebted and gone into huge debt. So there's pressure on budgets, increasingly so. So I think that's particularly why looking to the long-term disaster risk reduction is just one one element of trying to get that value for spend, if you like, over a long period of time. But it is, I think it remains to be seen. Certainly, all budgets and ODA has been declining as far as we can see, and we're being increasingly under pressure because of what we've just come through over the last 18 months or 2 years as we come out of this extra global shock. And on top of that, in terms of trying to manage COVID response in our developing world, we know that as our WHO friends keep saying, that no one is safe until everyone is safe, and we've not yet squared that circle in terms of coming out of vaccination rollout to particularly to sub-Saharan Africa. So I think there's a discourse that we've yet to have and to have with IFI, or our IFIs, and our position in the boards can perhaps influence that to some extent. But I don't know if there's any easy answer in the current context, given that we know that humanitarian needs are likely to increase and the budgets are declining.
Thanks very much, Patrick. I'll now put a question to Georgina, if I may, which comes in fact from Nancy Pendarvis-Harris. And the question is a very good one. If you take, say, somewhere like South Sudan, asks Nancy, how do you deal with pervasive corruption in building a system, let's say at local level, of the kind that you were describing earlier, Georgina? Could you take that?
I can indeed, and I think it's a great question. And David, as you say, I think it's not just limited to South Sudan. There are a number of contexts we work in where we would face similar issues. So I think what's really important is in a lot of the contexts we work in particular in areas where there are maybe actors that are non-state actors in particular, we would have in place a lot of checks and balances. And let's take the example of a Ministry of Health. If we were supporting them, we would have checks and balances in place the same way we would have with any other partner that we would deal with as part of our work. But I think it's interesting because normally when you build the trust and you invest in the partnership, and rather than goal paying the team, we're building that partnership with the Ministry of Health to support them to build the team. And I think you'll find that when you take that approach, it does go a long way towards there being more acceptance, let's say, of checks, balances, and a conversation as regards why we need to have all these things in place, because it's recognized that we are actually trying to build a system. So I think that's a great question. And I do think building those local relationships goes some way towards that. But I would say, it's those checks and balances in place that are really needed at the end of the day, the same for any other partner. So great question. Thank you. Okay,
thanks, Georgina. So we're now going to open up to the questions from the audience, of which there are many, and they're all terrific. But I see one that I'll begin with, which comes from Brian Kelly. Hello, Brian, long time no see. And Brian has a very practical question. What recommendations would any of the panelists give to some of the largest donors engaged in humanitarian assistance and DRR? Brian points out that there is a programming gap between ECHO and the European Commission. How should the humanitarian and the development donors, if you see them as two separate sides, really, how should they engage with DRR and transition issues?
If I may perhaps share some.
Thanks, Daniel. Yeah.
Yeah, I think we still need to see those connections, the nexus stronger within the funding structures and the funding architecture, which is still, I think, way too compartmentalized. I think there needs to be more support from the donor side to make that connections, and I think more integration of DRR within the development side of the continuum. I think we are making progress. the pandemic was a big eye opener for many, and I think increasingly there's more flexibility in funding and there's more attention to addressing risk. But I think those challenges largely still exist.
Thanks, Noel. So I'll get to as many questions as I can from the audience. There's one here from Milward Ramvani, who says that the case studies that Goal mentioned from Syria are very impressive, very encouraging to hear how seriously the long-term sustainability aspect was taken. He's curious to know how the peace aspect was factored into the whole programming. You know, he assumes it was a key part of the programming from the beginning. Georgina, would you like to take that?
Thanks, David. That's another excellent question. So I would say, you know, the Northwest context, Syria context is incredibly specific, as there are a number of actors involved in that. Some are international actors and some are local actors. I will say, though, that while we don't have a peace building program in Northwest Syria per se, we would have had a lot of conflict sensitive approaches in any of our programming. It would have been very much a key driver in our work. And of course, the do no harm aspects of our programming. But a focus just on peace was probably not something we engaged in Northwest Syria. However, as I said, it's at the fringes of all of our programming. And, you know, just listening to the conversation about the Nexus approach, this, I think, really is the kind of the gap in that joined up Nexus programming when we talk about funding streams. It's not only humanitarian and development, it's also that the whole peace aspects as well. So I think it's a great conversation and one that we need to keep having, both as practitioners, I would say, and, you know, donors and all of us together. So great question. Thank you.
Thanks, Regina. Question now from John Edwards. John asks, how can adaptive management support be ensured? And, you know, that's to say, sort of long-term, flexible, local and trusting management. How can that be assured given that governments investing in humanitarian and development work are increasingly parochial in their approach? As our learning and understanding of what works goes forward, says John, the investment environment seems to be going backwards. Maybe, Sonny, could I throw that to you?
Great. Yeah, no, great question. And, you know, it goes into the importance of having interventions that create evidence that are able to be sustaining, to show that there's a measuring, showing that there's actually proof in the ability that a lot of these contexts and these thinking and approaches are working. A lot of times as we all probably aware of, a lot of times, sometimes good programs do not continue to be funded, you know, not necessarily because of lack of funding, it's because of priority of funding. And when good programs can't create evidence that within localization or into the connections, it tends to be kind of dismissed or overlooked. And so one thing I feel that we need to continue to build is not only the programs that create evidence that we're able to show that impact and the serving the localization agenda and the impacts that we're trying to see, but also the research that contain with it. And systems approach allows that to systematically you know, achieve that and integrate it in part of the approach in it all, including research and evidence building.
Thanks, Sonny. A question from Rasha Abu Salem. It's an interesting one that Rasha points out there are many discussions about the importance of including grassroots local organizations in order to achieve sustainable and realistic change in the field. Yet these organizations are rarely included in wide-scale conversations, which are usually dominated by larger, better-known organizations. So how can we better incorporate the smaller organizations, which, you know, it's clear from the field have done really the bulk of the field work at times? They should really have a seat at the table. Could I perhaps ask Patrick to have a go at that?
Thanks, yeah, an excellent question again, and it's always a conundrum in development programming, even from the donor perspective. You do tend to, or more easily, end up working with the larger NGOs, be the international NGOs or the larger local NGOs, because they usually have systems in place and compliance systems which can fit our requirements. So it is more difficult to work directly with smaller NGOs. What we've done in the past is try to have a more flexible approach with, or encourage the larger NGOs to work with other grassroots CSOs, if you like, in a capacity building mode itself, and to bring them along in their own development path, that they're all on a journey in terms of their own work. So we have encouraged that in our own programming. I know in Ethiopia we did that through a number of national programs, the Ethiopia Social Accountability Program and the Civil Society Support Program, which supported over 1,000 civil society and NGOs throughout Ethiopia. So I think it's a question of being, for donors in particular, to be flexible, but also for other NGOs who do believe in localization. I think the like of Goal and Concern and major Irish NGOs do that very, very well. The Trochra, the Irish NGO, works only through partners, local partners. So partnership, localization is something which we look for in our interactions with NGOs, even though we know it's not always easy, but we do encourage it.
Thanks, Patrick. Sorry, every time I'm calling out a question here, the thing hops. Give me a moment while I get. There was a good one from Elliot Brennan, which I wanted to come to. Just 1 second. Elliot says that the bread markets case study makes him think of the global food price crisis, which fueled Syria's instability in the lead up to the civil war. You had, for example, food price spikes in 2007 to 8 and migration of rural population to urban centers and so on. Can anyone speak to research which any of their institutes may be doing on the intersection between sort of development, resilience on the one hand, and conflict prevention on the other? Maybe now, can I go back to that, or Georgina, as you like?
Very short. I will direct the attention to the chapter 15 of the Global Assessment Report, and I think because of the background of the you made for the discussion or for the question, I would also direct the person to the GAR special report on drought. Over.
Thanks very much, Noel. A question from Ross O'Shea. He thanks, by the way, all the panelists for their presentations, and he asks, how can the private sector contribute to DRR in fragile and conflict-affected countries, apart from just donations and finance? Maybe, who would like to take that? Can I ask Sonny?
No problem. And I know we're running close to end of time, so I'll make it very brief. You know, I think it goes back to the theme that we're saying is that only together, that there needs to be a collaboration for. When it comes to private financing, there tends to be other metrics that's involved, you know, including the marketing and the self-interest that it aligns. But that doesn't mean that private sector is not welcome. I think it's one of those joint partnerships that need to come in and come with the same vision. In terms of the role of how they play it, I know there, and Nahul, if maybe you could step in for a second. I know that there's partnerships with private sectors and with United Nations and a few other institutions that put it together as a collaboration. And again, collaboration is the key, not necessarily a top-down approach, but a very listening from a localization approach to bring it together. But Nahul, can you quickly step in before we end this webinar?
Yes, we promote an initiative called Arise. It's a network of private sector from companies engaged in DRR and committed to implementing the Sendai framework. And there's networks in Haiti and in many countries. But the Global Compact, the Connected Business Initiative from OCHA and UNDP. This is key. If we do not support people to access opportunities, to rebuild the markets and to sustain their livelihoods, these efforts will be in vain. And there is no resilience if there are no livelihoods and no opportunities for communities. Over.
Thanks, Noel. I think unfortunately we are coming to the end of the webinar. I'd love to keep it going for another half an hour or so. We have many questions, and thank you to everybody who asked questions, who put comments into the Q&A function. They're all very interesting and challenging, and as I say, I wish we could go into them more. It's probably for me just to thank everybody, the panelists and the audience, for contributing. I myself have learned a huge amount from the exchanges. I think the concept I take away most of all is complexity, that as we try to build resilience, there are so many intersecting sort of desirables. We need to anticipate crises. We need to have local systems which are inclusive, which are effective, and these often have to be developed without the benefit of a central government structure in fragile and conflict-affected countries. There are many other takeaways I have myself. I won't take up time with those, but I think I will just hand over at this stage to Aaron to conclude the webinar. And thank you to everybody.
Thanks, Ambassador Donoghue, and thank you all for attending this webinar and engaging in what turned out to be a really dynamic and fascinating discussion. Ambassador, I'd like to thank you for moderating. Speakers, thank you for taking the time to share your expertise. Really appreciate that. Also like to thank our sponsors, our donors, Irish Aid and the Party Global Progress Initiative for supporting this webinar series. And then all of you for attending this series. We couldn't have put it on without you. Our next spot, we're going to be continuing this. This is the first, as I said, of a 3-part series. Our next one is on November 18th and focuses on health system resilience in conflict and fragile affected conversations. So that'll be a continuation of this conversation. So thank you again for being here, and happy International DRR Day. Thanks.
Thanks, Aaron. Thank you.